We undoubtedly know Lyme disease is extremely common in Minnesota. Minnesota is the number 5 state in the country, Wisconsin's number 4. So if we're here, we know we're dealing with Lyme disease on a semi-frequent basis. $300,000 to $400,000 cases a year in the United States. And when you look at the data, that means 40-ish thousand in Minnesota, 45 to 50,000 in Wisconsin. And so if you think 10 to 20% of these are going chronic, we'll say 8,000 cases a year, every year in Minnesota, that's adding to this mysterious Lyme disease, problematic population. And this has been going on for years, which means we have, maybe 50, 100,000 different Minnesotans suffering with this. So I will tell people, if you are mysteriously sick and don't really know the cause, we're in Minnesota. It's on the table. Somewhere between 20 to 50% of people get a rash, which means 80 to 50% of people don't get a rash. So we tell people, well, the rash is awesome, because if you get the rash, you kind of know, oh, this is it, slam dunk at home. There's a huge portion of people that don't get the rash that have this problem. The big Minnesota co-infections are babesia, which is very famous. People talk about babesia, Bartonella, and Borrelia. Borrelia is Lyme, Barty is Bartonella, right? We get these, affectionate names. But the one in Minnesota, actually the number 1 co-infection in Minnesota, is called anaplasmosis. Now, I talk to most doctors about this, and they go, what? Anaplasmosis? And this is very mysterious to doctors because it causes low white blood cells in an acute infection. It causes a slight elevation in liver enzymes. Not a crazy elevation, but a slight elevation. Usually it stays under 200. So what I get is I'll catch people who have been chronically sick, and they say, yeah, when I got sick, I went to the doctor. Okay, did they run some tests? Yeah, and they didn't know what was wrong because my white blood cells were low. I said I was all fine. Were they worried about your liver? They were worried about my liver. So, okay, but that got better, a couple weeks to a month. I said, okay, has it sporadically popped up in the last 5 years or whatever? Your liver has kind of popped up every once in a while? It has, but it always goes back to normal. I go, okay, that's anaplasmosis. We are the number 5 state in the nation. Wisconsin's number 3 for anaplasmosis. Maine snuck in there. Maine's number 4. And this is a disease that is weird because it causes slight elevations of liver enzymes, low white blood cells. Doctors are very confused by it. No one tests for it. So one of the secrets in my office is I run an anaplasmosis test. It's not expensive. It's maybe $100, $90 or something like that. And we find a lot of people who have anaplasmosis because the standard testing is you run Lyme, and if that's negative, you run nothing else. Now in Minnesota, I really think you should run Lyme with at least babesia and anaplasma, because those are the 2 most common at a minimum. Because we do find people who are negative on Lyme and are positive on anaplasmosis. Over 2/3 of our patients that this is on the table have never even had it mentioned. So all I do is I bring up the maps, I mention the numbers, and I go, you should look at this. This is really a possibility of what may be causing your problem.
One of the questions that we get very often on Trailhead Health is, I have arthritis, never been tested for Lyme.
Yes.
Should I be tested for Lyme?
Absolutely. The symptoms for Lyme that we really see extremely prevalent, it causes pain. It frequently causes pain, and that can be headaches, migraines, that can be arthritis type joint pain, can be muscle pain, but it very frequently causes pain. Probably 3/4 of the time causes pain. The other big symptom is it causes fatigue. And if you have chronic fatigue, it's a big player for how it can do. If you have both kind of fibromyalgia fatigue syndrome, it's way high on the list. And the third symptoms it really causes frequently are the neurological symptoms. So we get anxiety, depression, we get POTS, we get very abnormal neurological sensations, and Dr. Paul can talk more about that. But if we see neurological symptoms, brain fog, with pain and fatigue, those are the big things in my brain that start to light up of, is this a Lyme patient in front of me? At least has to be considered. And we've had other people who have been told, well, you're just going to hurt, and we find, no, this is coming from Lyme.